Cytomel, also known as liothyronine, is a medication used to treat an underactive thyroid, also known as hypothyroidism. It helps to replace or provide more thyroid hormone, which is normally made by the thyroid gland. This medication is especially important for children, as having enough thyroid hormone helps them grow and learn normally. In addition to treating hypothyroidism, Cytomel is also used to treat other types of thyroid problems, such as certain types of goiters and thyroid cancer. It can also be used to test for certain types of thyroid disease. It's important to note that Cytomel should not be used to treat infertility unless it is caused by low thyroid hormone levels. When it comes to the daily dosage and optimal timing, it's best to follow your healthcare provider's instructions. They will determine the right dosage for you based on your individual needs. As for the best time to take Cytomel, it's typically recommended to take it on an empty stomach, at least 30 minutes before eating. Always consult your healthcare provider for personalized advice and guidance regarding the use of Cytomel. When taking Cytomel, it's important to follow your doctor's instructions and take it once daily at the same time every day. This helps to keep your thyroid hormone level stable. It's also important to take Cytomel regularly to get the most benefit from it, and not to stop taking it without talking to your doctor first. Typically, thyroid replacement treatment is taken for life. The dosage of Cytomel is determined based on your medical condition, age, lab test results, and how you respond to treatment. It's important to note that certain medications can decrease the absorption of Cytomel, such as products containing aluminum or magnesium, antacids, calcium supplements, iron, and others. If you take any of these medications, it's recommended to take them at least 4 hours before or after taking Cytomel. If you experience symptoms of low thyroid hormone levels, like tiredness, muscle aches, constipation, dry skin, weight gain, slow heartbeat, or sensitivity to cold, you may see an improvement within a few days of taking Cytomel. If not, or if you get worse, it's important to talk to your doctor. Some people may experience temporary hair loss when they first start taking Cytomel, especially children. If this continues or worsens, it's important to let your doctor or pharmacist know. It's important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. Most people who use this medication do not experience serious side effects. While it's unlikely, it is possible to have too much thyroid hormone. If you experience symptoms such as headache, mood changes, increased sweating, diarrhea, or menstrual changes, be sure to tell your doctor right away. Seek medical help immediately if you experience serious symptoms such as chest pain, irregular heartbeat, swelling in the ankles or trouble breathing. Although rare, a serious allergic reaction to Cytomel can occur. If you notice symptoms such as rash, swelling of the face or throat, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so if you experience any other effects, be sure to contact your doctor or pharmacist. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Cytomel is a medication that is not intended for weight loss. Using it for weight loss purposes is not recommended as normal doses will not be effective and large doses may lead to serious, possibly fatal side effects, especially when taken with diet pills. It is important to only use Cytomel as prescribed by a healthcare professional for its intended medical uses. The usual daily dosage is based on the individual's medical condition, laboratory test results, and response to treatment. It is typically taken once a day, in the morning on an empty stomach, at least 30 minutes before eating. Always follow the dosage instructions provided by your doctor and do not adjust the dosage without consulting them first. Before taking Cytomel, it's important to tell your doctor if you are allergic to it or if you have any other allergies. This medication may contain inactive ingredients that could cause allergic reactions or other problems, so it's best to talk to your pharmacist for more details. You should also inform your doctor about your medical history, especially if you have decreased adrenal gland function, heart disease, high blood pressure, diabetes, or diabetes insipidus. If you are planning to have surgery, make sure to tell your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's important to inform your doctor because your dose may need to be adjusted. Cytomel may be used during pregnancy, but it's best to consult with your doctor. Additionally, Cytomel passes into breast milk but is unlikely to harm a nursing infant. However, it's still important to consult your doctor before breastfeeding. When it comes to the daily dosage and optimal timing, it's best to follow your doctor's instructions. They will be able to provide you with the best advice on when and how much Cytomel to take based on your specific condition. Now let's talk about how to use Cytomel. It's important to be aware of any potential drug interactions that could affect how Cytomel works or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure that you are using Cytomel safely and effectively. As always, consult with your healthcare provider for the best time to take your Cytomel, as well as the daily dosage that is right for you. If you or someone you know has taken too much Cytomel and is experiencing severe symptoms such as passing out or difficulty breathing, it is important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of an overdose may include a fast or irregular heartbeat, chest pain, difficulty breathing, and confusion. It is important not to share Cytomel with others. Your doctor may also conduct lab or medical tests, such as thyroid function tests, while you are taking this medication. It is important to keep all medical and lab appointments. If you forget to take a dose of Cytomel, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Do not take a double dose to make up for the missed one, unless your doctor tells you to do so. If you miss 2 or more doses in a row, contact your doctor. Make sure to ask your doctor in advance about what to do if you miss a dose and follow their specific instructions. It's important to store Cytomel at room temperature, away from light and moisture. Avoid storing it in the bathroom and keep it out of reach of children and pets. When it comes to discarding any leftover Cytomel, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, consult your pharmacist or local waste disposal company for the proper way to discard the product when it is expired or no longer needed. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.